So I'm here again with the GP from the First Aid Caravans. Tell me about the caravans. What sort of state are they in?
Well, there's 3 very dilapidated caravans that you would certainly not stay in if you were on a holiday, but they're camped out as makeshift first aid sites. We see patients, there's no confidentiality, unfortunately, it's just not realistic. We have plastic bin liner covering the couches. We have a chaotic amount of supplies. Sometimes we have what we need, other times we don't. We sometimes have to tell patients to come back another day. We have a referral system whereby, depending on the skill of the clinician who's volunteering at the time, may or may not be confident at treating somebody, and if they're not confident at treating someone and have a sense that they are sick, then we'll refer them to the health centre Salam in Calais. But for example, this morning we had a young man who was having an acute asthma attack. He needed some urgent care, which I was able to give with my GP colleague, but had there not been GPs there, and there's not always, it would have been unrealistic for him to have walked all the way to Salam. It's quite a distance, so there is an absolute need for that skill and ability on site, here in the camp. There's 10,000 patients. I mean, I'm a full-time GP managing 4,000 patients, 5 days a week at home. For there not always to be a doctor for 10,000 really needy, poorly vulnerable people is I think, extraordinary.
Yeah. And yesterday I was with you when you were treating a small Down syndrome child with a bird. So just talk through that as an example of what kind of things you come across with minors, because there's a lot of talk in the press that actually there aren't women and there aren't children, and there's plenty of women and children. Of course, men are in the majority, but, and the women don't come out necessarily to the male sections of the camp. Yeah. However, there are plenty of women and very, very young children.
There are women. It's not clear how many women there are, because we know that there are women who are confined to these dark tents and never come out, partly because it's vulnerable for them to do so. There are areas where the unaccompanied minors and the women with their children will be protected. There is a lot of concern, there is quite a lot of care for that population, but we haven't got enough intelligence or information to know what the actual need is. But our volunteers will go out on sort of walk rounds, but again it depends on whether people are coming out to say they need help and trusting enough. We don't have any female interpreters, which poses difficulties when we're trying to manage sensitive problems. And in terms of children, yes, yesterday we were locking up, going home after a long arduous shift in the heat, and a young lad with Down syndrome had a big burn on his arm and needed some care and attention there, and with some background care to question, well, how did this happen? How vulnerable is he? What care is he getting? He shouldn't be here.
And the translators help, don't they?
And they absolutely help. The interpreters, they work really hard every day.
They're
without
refugees
them,
from the
and
camp.
they're refugees themselves. And they need to be paid, and that comes from our pockets, volunteers. So funds are essential if we can sustain, this, small but impactful, help provision.
I mean, in the time that I was there and sat in the clinic with you, in the surgery with you in the caravan, you were literally seeing a patient after a patient after a patient with a queue of them out, for a very long queue out the back door, and that continues relentlessly for all the time that you're there.
Yes.
And without communication, as you say, then it's very difficult not only for the patients to tell you what the problems is, what the symptoms are, how long they've been experiencing those symptoms, but also extremely difficult for you then to treat them effectively if you're not able to communicate what medication they need, how they need to take it. A good example is the inhalers. A lot of people suffering from chest infections here, and so key is first of all establishing, is it a chest infection, is it hay fever, is it some other kind of allergy?
TB.
Yeah, is it TB?
Lots of respiratory problems.
And so, with inhalers we need to make sure that they've got the technique right, otherwise again it's just absolutely. Yeah. So translators are really, really important.
Yes, very much.
And as far as the equipment was concerned, what I noticed was, everything from basic cough medicines to cotton wool to antiseptic, sharps bins. Really, really crucial that we keep the medics who are working there safe. I mean, this morning we had a patient walking with scabies, and so again, we need donations for all of that. But most of all, we need some sort of coordinated efforts whereby it's great that health professionals are turning up and seeing where they're needed, but it's even better if they can coordinate their activities and their presence, so that we can rotate professionals and not have times when we've got huge gaps where there is nobody, and other times where we're overrun with too many health professionals and then they leave feeling despondent because they weren't needed at that time. And also making sure that they've got the right skills mix, because opticians are great for as an example, and of course everybody needs eye care, and I've brought along various spectacles with me, but what's even better for this is my own personal observations, are people who've got prescribing skills. Nurses are excellent, of course, but even better are GPs and doctors who've got a much more wider skill set and knowledge.
It's the mix. I mean, there are many things I couldn't do and absolutely needed that nurse skills,
like the bandaging
and dressings and all sorts of, working together in a multidisciplinary team setting works the best. And when we have nurses and paramedics and doctors together, it's fabulously productive and impactful.
Yeah, but as far as we know, there's no dentists. So I've bought a lot of oral hygiene products, but there's no actual set dentist place here, is there?
No, there's no setup.
But there's a huge need.
There's
for
a massive need.
help.
I've seen many tooth abscesses and broken teeth and poor dentition, and absolutely massive need for dental care.
Yeah. Thank you very much for your time, Doctor.
Thank you.